Thanks to both of you. I think those are really interesting, provocative presentations about some difficult work that's going on. It's not easy to do some of the social norm change that we're all talking about here today. Christina, did you say? Yeah. Well, we'll take some questions from the group, so please let me know. I know Christina has a question, so we'll let her start off.
I have a question for Gannon. Some of the people that you have pictures of, the woman, the older man, etc., are people that Molly told me about, and they seem to be natural leaders. Okay. Now, my question is, I'm studying actually trendsetters and the role of trendsetters in norm change. And what we see that often, especially if it is a norm that is very, very rooted in a community, a practice is very rooted, you will not have the village, say, leader starting a movement against it, but you may see people who are more marginal, if you will, in a network. And my question to you, because you have an enormous experience with all these villages, etc., who are the trendsetters? Are there some characteristics that they all share? Because they start something, Who are the people at the beginning who come to the community meetings, who are active, etc., etc.?
Did you all hear the question? Yeah. Yeah, it's a fascinating question. It was actually, I was jotting down some notes in one of the earlier discussions because I wanted to put it out to the room. It's a related topic. But so two things that come to mind. One, I don't think it's an accident that Demba was a religious leader and a traditional leader and a man, of course. And that gave him an authority when walking into communities that would not have been granted to other people. I also think that when you think about what Tostan's ambition is, which is really around agency, and especially the agency of women, and a lot of our model, and I haven't seen the last program H diagram, but a lot of our model is also about rehearsal and giving the class becoming a space to practice the conversation with your husband or to practice the conversation with someone else. I think in one way what we're doing is not creating leaders that could get us into a definition of leadership, which in 21st century America is kind of, but the natural leaders that I see emerging are there. I mean, and I just have to give you my personal opinion. Yeah. Yeah, I think these are often women who, yes, someone earlier said, if you do a survey and say, are women allowed to lead in this village? Men might say no. But if you actually just go watch what's happening and what's going on, they are already maybe sort of quiet leaders. And so what happens through the process then is that they're able to come into that more. And this provides them an opportunity to do that, right? So I don't know if that... Oh, sorry.
I'm very interested, and of course we cannot generalize, but whether in certain circumstances this natural leader may be very central, but in other cases they have to be peripheral. And women, in many cases, are peripheral to these big social networks. Okay, they are not, community leaders, etc., but it seems very important, that they must have some trend-setting characteristics that help them, basically start a movement or, act within an emerging movement, etc., etc. And women are important because in many traditional societies, they are not at the center of a power network. They are very marginal. And this is what I want, to stress and what I think is important.
Thank you. Let's take another couple questions. Go ahead. Can you use microphone, please?
What would, Maremba, is that her name? The woman you were talking about. What would she say when she is explaining to other people what this is? What is her concept of what's happening here? is first question. Second question is, are your funders satisfied with the presentation that you made to us as a way of understanding how effective you are, or do they want more from you than you've given us here?
Yeah, as someone, oh, sorry, was that?
No, just
Oh.
that the funders always want more.
This is what I was going to say. I think that in my experience, the funders always want more data than you have. I mean, that as a rule. We have been very lucky to have been supported by a range of funders that have been willing to look at the different ways that Tostan evaluates how effective it is and what's happening, and been okay to move forward with us.
You use a lot of different methods of evaluating and being held accountable.
Yes, and I think one of the things that we also do is say that if we need to take it seriously if communities are coming together to say these things. That doesn't prove anything, but we also need to not be overly skeptical to the point of downplaying how important it is that these events are happening, and not claiming that that means any more than it means, but not kind of wiping that off the table either because it's not randomized control, whatever. And then for your first question, the argumentation is what I think you're asking. Like, what is Mariam saying when she's in those other communities?
Yeah.
So this is the role of several things that's in our curriculum. The first is human rights. And again, human rights, I think when we imagine it, kind of become these disembodied things that would be very strange to talk about. But what happens in our model is that people are talking about human rights in very concrete ways and talking about how they relate to traditional values. And so just as an example, I was fascinated by the discussion earlier about religious leaders. We've been working with an Islamic specialist in Senegal who has helped us to map human rights against Islamic rights. And that opens up human rights in a way that it will never, if it's just presented in whatever scripts comes through the human rights system. It allows people to discuss it. And in our model, we're often asking questions that put the final onus of that onto the community members themselves. But so that human rights dialogue, and allowing her to start from a place talking about that she's been working on these things, that it's coming out of a place of love, that, you know, this is a place, these are things that we've all cared about. Education generally is a good thing. Girls being healthy generally is a good thing. Starting with the positive and then moving towards information that she would have on the harms of the practice. And this is another point to your point, Christina. Personal experience with whatever the issue is very hard to negate. So if Mariam happens to have been cut, and I won't share them here, but I mean, she's had very, very amazingly difficult experiences with the practice in her own family. So she can speak to it in a very powerful way that even Demba can't really, because she's a survivor and someone who wants to work on it.
And what is she saying about who you are? These people these white folks who came into the village and started
Yes.
these discussions.
Yeah. So I'm glad you asked, because actually the facilitators are not white folks. They are locally trained facilitators. Tostan is predominantly an African organization. And so you would never see someone like me in a village except to go and cheer on and try to learn. Yeah. But she would, very often, this is probably a nebulous answer, but when it's one of the things that has kept me at Tostan is when I first got to Tostan and I went and talked to people in the community, it became clear to me that when they talk about Tostan sometimes, that's a word that symbolizes the education that they've gotten as much as it's this organization that brought it. They're talking about the content, and very much in the way that I might talk about my grad school experience, right? I'm not talking about whatever experience I had. I'm talking about what I had there. And so it's very challenging for me to answer that, but yeah. Mm-hmm.
Thanks. I think we have some folks over here at the microphone. Do you want to go ahead?
Thank you for your presentations. Unfortunately, I missed Promundo's. I really wanted to hear what you had, but I had to take a call. But for Gannon, I wanted to ask two questions. One, with all of the work that has been happening and how much, how long participants are involved in the program for 3 years, have you seen a change in the local processes of consensus? Because of course there are always, local ways of doing things, and then there's what potential programs may bring to the table. Have you seen a change in how communities come together and how they come to a consensus on particular issues because of this process, whether it's different people coming in and making decisions or being part of the decision, whether it's an actual process within that consensus, but those changes. And the other question I wanted to ask was, so with respect to other gender outcomes, like, decrease in other types of violence, so, maybe domestic, maybe other gender-based violence, with respect to decision-making and, communication between couples, maybe norms of masculinity that may change. Have you been able to not necessarily measure that, but even if it's anecdotal, an anecdotal view of whether these things, whether the program has been able to affect those in the communities that TOS 10 is working in?
Let's get this other question over here. Did you have a question as well you wanted to ask?
I do, but it's on a totally different topic, and it's for Magali.
Okay, well, do you want to just,
I mean,
do you want to ask it, and then, or do you want to?
well,
Then
it might
Magali.
be good to let
Okay,
him
go for it.
answer.
Yeah, thank you for the question. So in terms of the consensus process, this is what one of the things our new monitoring and evaluation system is going to help us unpack at a much more detailed level. But certainly one of the things, and this we get anecdotally and also from some of our data, women definitely do participate more in the various levels of decision making. I also think we're going to see that extends to other traditionally marginalized groups, whether that's certain ethnic groups in a given context or the caste system in West Africa, which isn't often discussed. And I think that there definitely is some of that. And I would also say that we're also now seeing very regular outcomes. And again, attribution is maybe tricky on this, but a lot of women running for office in communities where we've worked. And in the last elections, a lot of them getting elected, so that'll be interesting in the local election system, which is a big deal in the context where they're at. And in terms of the other outcomes, we do see shifts in intimate partner violence. Like you're encountering, it's extremely hard for us to get at those in a rigorous way because of how to go about it and how to go about measuring it. But we very anecdotally, very often have sort of men who, and again, this was part of my kind of formative experience when I was living in Senegal, but I always wanted to talk to the men and kind of understand their perspectives of this model and this program. And they would say things like, yeah, I used to beat my wife all the time and now I don't do that anymore. Like really like strong statements that kind of took me back. But we're really, I found to be genuine and were coming about because of this program. Is that?
Thanks. Please go ahead.
Hi. This question is these questions are for Magali. In your evaluation of your program, I totally agree that changes in beliefs and attitudes are the beginnings of, changes in behavior, but ultimately you want to show that changes in behavior, or at least outcomes that are directly related to what you're trying to prevent. So when you're looking at things like your self-report of condom use, is there also some data on comparison of baseline to after the intervention of STDs? Like, is there any kind of surveillance system that you can look at that? Are there health workers that you can interview to get a sense of whether you're seeing reductions in that? Or is there a village nearby that you could compare so that you at least have something to show that it was leaning towards your intervention that made the difference? And I'm thinking the same thing in terms of the intimate partner violence. If you can talk to health workers about, are you seeing a reduction in women who, you're treating for different things? Is there some corroborating evidence? Even, it's not the same as a randomized controlled trial, but it does put more emphasis on the fact that it's your intervention that's having an effect.
That's a very interesting question, and I think that's what everybody would like to be able to do, to have, a quick way of combining different sorts of interventions. And it's just, in my experience, it's just not possible for a group setting when it comes to healthcare data and interventions that you're doing at an educational level or more social level. And even in my previous life, when I worked with Planned Parenthood, where the clinic was right next door, it was still absolutely impossible to correlate because you have HIPAA issues. You have to protect.
You don't need individual patient data or individual, if
Just
you have
go-
a
yeah.
general idea of looking at the number of different things that might be treated by a health worker that could be related to the work you're doing. If you can see the numbers.
I think you could, try to establish, to show that data, but to make the cross and say that one thing led to the other, it could be that, no, that population could be seeking services elsewhere, and the people who are going to that service could be coming from somewhere else, and you were making like an artificial, I don't know scientific, Lori, do you want to say something? Go ahead.
Can you find a microphone, please? Thanks.
Yes, I was just going to say, I think it's very possible to show empirically whether or not you're achieving certain outcomes that are either biologically based or behaviorally, actual reductions in violence. There are now 6 or 7 trials that have demonstrated actual reductions in violence. So you can do that. The problem is how to form the partnerships of trust between programs that have certain demands and the need to provide services and or programming and researchers. And I think in order to be able to do that, and it is possible, and I think the opportunity to do it is when programs are moving into new areas. Because it really, the key thing is where you're working when. And what happens is you have a program that is already, working in an area, it's very hard to come in after the fact and establish a type of evaluation where you can really make a judgment of causal attribution, right? That this caused this. But if a program knows it's going to roll out into a new district or a new set of districts or whatever, I think the model needs to be that you partner research groups or researchers or embed researchers, even better, into the program so that as that's done in such a way that you're accompanying the program and generating information that both will help actually answer some key questions, but also make course corrections, small course corrections along the way. So, I don't think the way to do that is actually through the health worker kind of data that you suggested, but I do think there are ways to do it, and I think we need, I think there's more interest in doing it now. Just the last thing I would say is, I think donors, I think the field is now at, in terms of violence prevention, when it comes to violence against children and women, I don't know the rest of the fields well enough. I think we're at this very odd period of time where people are really wanting evidence, and more money is being thrown at generating evidence and evaluation, but we're evaluating less than prime time ready programs. So there hasn't been a time where programs have been able to partner to do the formative work and the refinement and the optimizing of the programs before we go in and spend $1 million to sort of do these big kind of evaluations. And so I think we need to step back and create those partnerships of trust where you have people that understand the imperatives of programming and the imperatives of research, and you work together to compromise across those divides and, and optimize the programs and then evaluate them.
NIH does have an interest in community-based participatory research, and we do have models. The Office of Behavioral and Social Science Research at NIH kind of leads that effort for us. And so we are interested in funding that kind of research where you start with community relationships. The reason I mentioned health workers is because that's how you get around HIPAA. If a nurse in a doctor's office can go through medical records and give you the aggregate data that you need as a researcher. The researcher cannot do that, but the health worker is allowed to, to go through the records and tell you what the aggregate numbers are that you need as a researcher to form your baseline and to look at any impact. But
settings, it doesn't exist. That kind of data doesn't exist.
But you couldn't even do key informant interviews with whoever's providing health care in the community.
Well,
I know it's not a physician and it's often not a nurse, but.
Well, there are several things to, I agree entirely what Lori was saying. And we're starting right now with support from the CDC, a project with the Program H here in the US. And we're hoping that by engaging the researchers and the providers and the trainers and the everybody from the start, we may be able to get to that. We'll see. It's something that we're just starting. In the developing world where we did, and not in villages. In villages maybe where you have a smaller cohort of people you're working with, and you may set up some health service where you can observe. In my previous lives, we did that in Kenya, and with some degree of success. But the sample was so small that it's like, okay, in another setting where it's not that small, is it going to work? So in terms of the learning process that you get, you work because there were 100 people, and then you can establish that if you give this information and set up the service, you're going to have a circular process. In the case of our work with Program H, where we worked in urban areas that are very dense and diverse and convoluted, such as Brazil, Mexico, India, it's not something very straightforward that you do an intervention about violence, about masculinity, and that there is a component of prevention and health, and then you're going to see an impact that it's health related. And it wasn't even in our radar to try to set that up. It would be extremely expensive to begin with, and we were just learning to begin with if the model worked, if it was viable, if there would be acceptability. So now, 10 years later, where we've seen that, we're in a position to perhaps start moving ahead. But the example that I was given, that it's not about Promundo, but because I worked so many years with Planned Parenthoods, is sometimes you're talking about two separate animals. The health care portion of any organization is just so busy and ingrained in the provision of health with all the requirements and the laws and the HIPAA that you just don't have time to be doing all that. That for the educators to come, so can you cross and see how many patients came here because of the community health promoters or the peer educators, or it's especially in large urban settings is just it has been in my experience. I'm not saying that it's impossible, but my experience from the ground up is that it's very difficult to do that. But I would like to take the opportunity, what Lori just said about the emphasis on having behavior change that is measurable and that has a direct, quick impact on the so-called considered health indicators per public health standards is also something that we need to question. how the public health field is going to look at the intersection with the social justice field and try to understand the importance of attitude change and belief set changes, that we have enough information to know that eventually and to some extent they impact health and they impact behavior. And do we need to spend so much money to continue to prove that those interventions are not a luxury and that we're not here just playing with masculinities or with, empowerment at the ground of women in the villages? We're talking about something that it's the only way to try to change certain areas such as gender violence or gender stereotypes that get in the way of health, So that's what I just, wanted to throw there. We're not answering your question, but it's just that we don't have the answer. I don't have the answer, I'm sorry. I know she's not happy, but I don't have it.
Yeah. Do we have one more question before we? Oh, please use the microphone.
Sorry. I think both you and Laurie said exactly what I was going to say. It's a point that can be re-emphasized enough. It really struck me again when you said 10 years ago we weren't having these conversations. Now we are. And we really maybe, sort of look at where do we want to be 10 years from now? Do we want to be the people who are sort of like, oh, and guess what? This is not like vaccinations. It's not like building latrines. It's social. It's complicated. Do we really want to go back and say, let's measure it the same way that we've measured vaccination uptake? No, we don't. Do we want to count things? No, we don't. We want to measure things, and we do want to attribute things, but that doesn't mean we have to be counting things. We can be measuring them, and that's what I think we should be doing. How do we see ourselves? All our books on causality are from the 1950s, right? Cook and Campbell, RCTs, gold standard, they're all old texts. And why are we reinventing the wheel? Why are we not saying it's a brave new world? Let's venture out there.
I agree, and I would say, actually, in these discussions, I'm on several, consortium of different NGOs. At one that's very large NGOs, and then one that's very grassroots. The directions can go in the direction of saying, why don't funders do this, or why don't funders do that? I think in this moment right now, the opportunity is for the NGOs and the researchers to start to say, here's the alternative. Here's a new way of looking at it. Here's a way of approaching that, because I don't know if there's any other way to get there. And I would just complement this by saying we have done a little bit of the triangulation with the health centers. That was more for our own internal knowledge than to try to then use that to an external standard. And also we have an ongoing intimate partner violence study that's going on, but I didn't mention it because in some ways it begs a different problem, which is that it was in a new context, as Laurie was mentioning, and it's going to tell us an awful lot of new and interesting things. But it's also not a full reflection of everything else in every other context we work. And so we have to think about, so when we're evaluating, then what are we evaluating in terms of models that iterate differently in different contexts and all that. So anyway, but I totally agree.
Great, thanks. I want to help us close because it is 5:30. Did you have a final comment, Peggy, you wanted to make?
Yeah, I just wanted to say, sort of in defense of the RCT, because I'm at NIH and it's still the gold standard there. It's not the RCT so much, it's research methods that remove our human bias. That's what we want to do. We want to remove our bias because I always go back to this. Patrick's probably sick of hearing it, but Project DARE in the United States, drug abuse resistance education, which most of our kids, or maybe even some of us went through, millions of dollars were spent on delivering that program to schools in the United States, millions. The program is loved by teachers, it's loved by parents, it's loved by the police departments, it's loved by students, but it does not prevent kids from using drugs, which is what the money was spent on. We need programs to prevent kids from, and it wasn't until we evaluated it in a non-biased manner to say, this doesn't work. This isn't doing what the program was intended to do. And that's what we try to guard against with, you know, good, sophisticated, strict methodologies. It's to remove as much bias as we can so we know if what we're doing is really achieving the outcome that we intend to do.
The problem is sometimes some intervention works for completely different reasons from what you imagine. And yes, but then before the intervention, you have to have certain hypotheses about these communities and the reasons why an intervention. So you have to have a lot of different hypotheses that I don't see around. I'm doing a major work on sanitation, for example, and in Pakistan there are communities that adopted latrines and then, you know, it decayed very rapidly. And, you know, they are completely in the dark about why it happened. And one suggestion, one hypothesis is, well, this community may have not been very cooperative to start with. And so what you want to do is to do maybe some field experiments with new communities and distinguish between those that are more or less cooperative, because using and, you know, keeping latrines means being very cooperative with the rest of the community. You know, very often there is a social dilemma there. You know, I go behind the bush, you all use the latrine, we're fine, okay? And it's very, very important to realize whether certain communities are particularly apt to solve social dilemma problems and others are not. And maybe, you know, the answer to the failure is these communities were already having problems doing things together, for example. You know, this is just an example of all the hypotheses that you have to have in mind. And this is what we do when we do experiment. We have several hypotheses and we cut it down, basically.
Okay.
This is expensive. And because you have to do sampling, you know, you cannot go to 3,000 villages, et cetera, but it's something that should be done.
Thank you. I'm going to encourage us to carry these conversations on. Obviously, we have a lot of rich experience to share. I want to give Gannon and Magali, did you have any last points you want to make? I really want to thank you for your contributions today. It's been really a rich discussion, obviously. People still want to continue. Before we close, I just want to thank everybody again for their participation today. It was a really wonderful full day of a lot of diverse topics. We're going to be continuing on tomorrow starting at 8:30. I also want to thank our remote viewers, those who've been observing the webcast. And again, have a wonderful evening, everyone, and thank you so much today. Bye. Thank you.